हेलो दोस्तों, आज हम बात करने जा रहे हैं शॉक के बारे में। व्हाट इज शॉक एंड इट्स क्लासिफिकेशन के बारे में बात करेंगे। सो इट इज़ a systemic state of low tissue perfusion inadequate to meet the normal cellular respiration. So how it occurs? At the cellular level, there is decreased perfusion to the tissues, which shifts the metabolism from aerobic to anaerobic metabolism. This anaerobic metabolism leads to the accumulation of lactic acid in the blood, which leads to metabolic acidosis. Now, because of anaerobic metabolism, there is decreased amount of ATP. This leads to the failure of sodium potassium pump in the cell membrane and the cell organelles, which leads to the breakdown of lysosomal membrane and release of autodigestive enzymes, which leads to cell digestion and release of contents in the blood, such as if potassium is released into the blood, it leads to hyperkalemia. Now, because of metabolic acidosis, there is increased respiratory rate and minute ventilation. Why this is increased? To excrete the excess CO2. This is known as compensatory respiratory alkalosis. Now, coming to the heart, there is decrease in preload and afterload, which activates the compensatory baroreceptor response. This increases the sympathetic drive, which leads to tachycardia and vasoconstriction at the GIT and skin. Now coming to the kidneys, in the kidneys there is decreased perfusion. This leads to decreased glomerular filtration rate, which leads to decreased urine output. Because of decreased perfusion, the renin-angiotensin mechanism is activated, which leads to vasoconstriction of blood vessels and increased sodium and water retention. So basically what is happening in shock is decreased urinary output, metabolic acidosis and increased sympathetic drive. Now we come to the classification of shock. The shock is classified into basically 4 types: hypovolumic shock, cardiogenic shock, obstructive shock and distributive shock. Now coming to the hypovolumic shock. Hypovolumic shock, it is due to reduced circulatory volume, which can be hemorrhagic or non-hemorrhagic. The non-hemorrhagic causes are dehydration, vomiting, diarrhea, diabetes and third space loss. What is third space loss? It is loss of fluid in the GIT in cases of GI obstruction and pancreatitis. Now coming to the cardiogenic shock. What is cardiogenic shock? It is failure of heart to pump the blood. What are the causes? Causes are dysarrhythmias, valvular heart diseases, cardiomyopathy due to bacterial and humoral agents released in the cases of sepsis. Now coming to the obstructive shock. It is due to decreased preload to the heart. What are the causes? Causes are cardiac tamponade, tension pneumothorax, pulmonary or air embolism. These all will lead to decrease in cardiac output. Now coming to the distributive shock, it is severe response to septic shock, anaphylaxis and spinal cord injury. These three will lead to inadequate organ perfusion, which is accompanied by hypotension, decreased systemic vascular resistance, which decreases the afterload, and because of decrease in afterload, there is increase in cardiac output. So, in the cases of distributive shock, there is increased cardiac output and decreased systemic vascular resistance, where it is a special character of distributive shock where cardiac output is increased and decreased systemic vascular resistance. In rest other shocks, there is decreased cardiac output and increased systemic vascular resistance. Thank you.